like to take this opportunity to thank MAA for giving me the award for the outstanding anatomy in research for the last conference in Kelantan. So for today, I'm delighted to share with you my research that focus in intervertebral disc degeneration and specifically how I could modulate inflammatory pain in degenerative disc disease using a biomaterial and stem cell, and also how this research has progressed from the regenerative strategy towards a precision medicine. So we know that 60 to 80% of our population suffer low back pain in the lifetime, and intervertebral disc are one of the causative factor for this problem. And if you look at the pathophysiology of the intervertebral disc, what happened in the early stage of degeneration is imbalance of the metric homeostasis that also can reduce the water content or also can make a lower cellularity in the intervertebral disc and also can increase inflammation, and this can induce the hyperinnervations of the nociceptive nerve fiber into the disc, and this result in discogenic back pain. And critically, current treatment include the medication, rehabilitation, and also the last result of the surgical intervention mainly aimed to reduce pain, but none of these treatment are not regenerative in nature. And for this reason, my research focus in the regenerative strategy using biomaterial and stem cell that can promote tissue regeneration and also can target discogenic pain in the intervertebral disc. So for example, here we can design this biomaterial as injectable or implantable hydrogel system to be delivered into the intervertebral disc, and this biomaterial can be natural or synthetic from the biomaterial itself, and then this biomaterial can be combined with the therapeutic molecule to target the multiple signaling pathway that underline the disc degeneration and also causing the low back pain. And also we can design this biomaterial, incorporate them with the stem cell, for example, to repopulate the native cellularity of intervertebral disc so that we can get the tissue regeneration in the intervertebral disc and also can reduce pain. So that's the aim of this study. So in my study, my strategy is to develop the extracellular matrix-based hydrogen system. So using the hyaluronic acid and also the type 2 collagen. So this hyaluronic acid is a non-sulfated glycosaminoglycan, and also we can find predominantly in the intervertebral disc and also exhibit unique properties that can retain water for the dehydration and also exhibit the viscoelastic property for the biomechanical function. And the best of this hyaluronic acid has been shown to reduce inflammation and pain. And similarly for the type 2 collagen is an abundant structural protein where we can find in the intervertebral disc and also have a unique property that has been used as a 3D microenvironment to promote the chondrogenesis in the intervertebral disc. In my previous study, I have developed the HA hydrogel, either injectable or implantable system, where we have shown that this hydrogel promote tissue repair and also reduce pain. And for this implantable, I have translate into the injectable system. What I did here is that to develop the injectable system and then inject in the animal model in the rabbit. So what we found here is that this hydrogel promote tissue repair evidenced by the histological feature of the intervertebral disc, and also it can restore the disc height and hydration confirmed by the MRI analysis. And also the therapeutic effect of this HA itself, it can exhibit anti-inflammation, so it reduces anti-inflammatory markers and also slightly reduce the innervation marker. So having this motivation here in UKM, my strategy is to develop the collagen-based hydrogel, which is one of the predominant accessible metric in the intervertebrates, and then enrich with the hyaluronic acid so that I can get the therapeutic effect of this hydrogel. So what I did here is that I combined this hydrogel with the mesenchymal stem cell derived from the water jelly of the umbilical cord, where we use this hydrogel system to differentiate, to give a 3D microenvironment for the MSC to differentiate into the MP-like cell before we can do the in vivo implantation. So what I did during my postdoc in orthopedic is to develop this hydrogel system fabricate using the collagen-based hydrogel, enriched with the HA and with the cross linker, and then encapsulate with the stem cell, and then tune this hydrogel system with the variable of the macromolecular weight ratio concentration, and then check for the stability and also enzymatic retardation and also the MP-like cell phenotype. So here we successfully fabricate the collagen-based hydrogel, as you can see in this photograph, and this hydrogel was stable over time, and also you can see that this hydrogel shows high enzymatic retardations over time and with higher swelling properties. So in the hydrogel where we encapsulate with the mesenchymal stem cell exhibit higher cell viability up to 14 days after we differentiate the MSC towards the MP-like cell. And also this evident by the round morphology shape of the MP cell indicate in the light microscopy. Also with the reference photograph here, and this also confirmed with the high expressions of the SOC9 in this MP-like cell markers. Okay, so SOC9 is one of the MP marker for the intervertebrates. So having the in vitro result, okay, in this FRGS project in anatomy. So what I did here is to pre-condition the MSC in the hydrogel system for 14 days, and then we did implant this hydrogel in the rat tail model where we surgically induced this injury in the coccyx level of the C 4, 5, and 5, 6, and then we keep the animal recovery for 1 month. And then we also, in parallel, we did the von Fleet test for the mechanical allodynia, and post-mortem we did a measurement for the disc height using a plain radiograph and also dehydration by MRI, and some of the post-mortem analysis for the disc histological feature and also expression for the GAP43 for the innervation marker. And this project was done by our FRGS project team in anatomy and orthopedic. So we have one PhD, one Dr. Pakar orthopedic, and also 2 group of the SSM student of the medical doctor. And also we have a collaborator that helped us for the radiological analysis in USIM. So for the bond free test, what we found here is that you can see that reduced withdrawal threshold in the injury group, indicating that injury induced mechanical allodynia. And also you can see that interesting enough, you can see increased trend in the hydrogel treated group of the withdrawal threshold, indicating that hydrogel inhibit pain in this animal model. And here you can appreciate the histological image. Here you can see that the degenerative atrophy of the cartilaginous area in the intervertebral disc with the disarrangements of the nucleus pulposus, and this also organized of the lamella of the nucleus pulposus and with the disc collapse. And here in the hydrogel treated group, you can see a nicely organized of the AF lamella and also improvement of the microscopic feature of the intervertebral disc indicate that the tissue repair in the intervertebral disc after we implant with the hydrogel. And also we did some of the GAP43 standing for the innervation marker for the outgrowth of the nerve fiber. And what we found here, that increase of the GAP43 expression in the injury, however, is only slightly reduced in this innervation in these markers. Moving for the radiological analysis, this is help with USIM. for the analysis of the plain radiograph. And what we found here is that reduce of the this high in the injury group, indicating that injury reduce this high whenever we surgically induce in this animal model. And here you can see increased trends of the this high when we implant this hydrogel in the disc, either with hydrogel or either hydrogel alone or hydrogel with the mesenchymal stem cell. And this result suggests that hydrogel with the MSC, without or with MSC, can promote this height for tissue repair. And also for the MRI analysis, we did the T2 mapping using MRI. This reflects the dehydration in the nucleus bulbosus. So what we found here is that when we induce this injury, indicate the reduce of the T2 value, indicating for the reduce of dehydration. However, we only see a slightly increase in the hydrogel treated group, but no improvement in the MSC itself. So from the implantable efficacy study, we want to know either this hydrogel is safe to be used in vivo, at least at this moment. So we did a biocompatible study in collaboration with the Magma Biosurasi in UK and Bangi. So what we did here is that to do the in vitro cytotoxic using the MTT assay to check the exposure of the hydrogel in the presence of the fibroblasts up to 24 hours in culture. And also we did implant this hydrogel for we inject this hydrogel, we design this hydrogel in the injectable form using the double barrel injection system for the in vivo intracutaneous in the multiple skin site on the dorsal part of the healthy rabbit to check for the acute reactivity on the skin. So here you can see that the increase of the cell viability of the fibroblast when we expose this hydrogel in the fibroblast culture, indicating that there is no cytotoxic in the fibroblast culture. And for the in vivo study, we found that this hydrogel also shows no acute reactivity, where there's no indications of the erythema or edema when we inject the hydrogel in this rabbit model, indicating that there is no adverse effect on the acute reactivity. So this will confirm the biocompatibility of this hydrogel to be used for the in vivo study. So, and then from developing the biomaterial with the stem cell, and then now this research has evolved from this regenerative towards developing the intro device diagnostic device using through a precision medicine approach. So this is the DISPIN project based in Galway in Ireland. So what I did here is that I incorporate 3 pillars that include the fundamental discovery and the translation study. For the fundamental study, I focus on the precision medicine to do the transcriptomic profiling of the neuroinflammation and also pain-related marker in degenerative disc disease. In the subgroup patient with a low back pain, and then when we have the information, this will give an insight how we could develop the disc on a chip device so that we can model the disease microenvironment based on the patient phenotype in vitro, and then having this on a chip, we can translate into an in vitro device diagnostic medical device for the drug testing or any therapeutic target that can target the disease mechanism in this degeneration. So what I did here is that we collect the sample from this patient, and then this AF and MP cell being used for the transcriptomic profiling through the precision medicine approach. And also this cell we use for the developing of the organ on chip, which is this on the chip device using the hydrogen system with the interface of the nucleus pulposus and annulus fibrosus with the ingrowth of the sensory fiber into the annulus fibrosus, and we see the cellular response and ion channel activity for the therapeutic target and also for disease model. So moving for the methodology, so what we did here is that we have a patient MRI and also a patient sample from disease from patient undergoing or underwent spinal surgery. So we stratified, we do the patient stratification by using a Fuhrman grading. So we grade into grade 1 and 5, and then we categorize into mild or severe degenerative with the symptomatic low back pain. And for the sample, we send for the RNA sequencing analysis. And this project has been done ongoing by my PhD masters and also undergraduate in Galway, and both masters in anatomy and PhD in Galway. So at the moment, we have grouped the patient into grade 4 degenerative disc disease with the low back pain, grade 5 4 with the low back pain. And for the source for this patient group, from the Galway University Hospital at the moment we have, and also we have from the Asylum Mentor for the healthy adults to mesh the age mesh control for the degenerative disc disease, because this disease prevalence in the adult. And also we have the healthy adolescent disc we get from patient from the scoliosis patient, where we get the sample from the Children's Health Island in Dublin. So this is the multi-center collections of human discs for this project, and for specifically for to get the healthy sample during the Asylum Mentor program in the University Malaya, we established the protocol for the cadaveric spine dissection to harvest the intervertebral disc through the anterior approach with the laboratory approach in order to get the intact intervertebral disc, as you can see in this photograph. And this is my master student project in anatomy, and here we have team to perform this cadaveric spine dissection under the leadership Professor Sabaro. And then moving for the demographic data, this is the data that we have with the grading grade 4 and 5 degenerative disease 11 and 10, and also we have control for each for the healthy adult and healthy adolescent, and we grade in the this grade indicate by the MRI feature in the patient MRI based on the Fuhrman grading. And then when we compare the gradings of the MRI in patient with the age and gender, you can see there is more prevalence in the patient more than 40 years old. Okay, years old, but however, there is no significant in terms of the gender. Okay, for moving for the molecular analysis, okay, we're going to use the RNA sequencing analysis and bioinformatics. And here from patient sample, we directly keep the sample in -80 because we want to get a fresh frozen sample to be run for the RNA extraction and send the sample for the RNA sequencing with the company. And also we did the optimize of the tissue homogenization, because we know that during the degenerative, in the degenerative disc, we have very low cell number because of the degenerative feature. So we have to struggle with the tissue optimization in order to get a very good number in terms of the concentration for the RNA for the RNA sequencing analysis. So this project is still ongoing. However, today I'm going to share with you the result for the RNA sequencing in the advanced stage degeneratives from the public domain RNA sequencing dataset using from where we get from the Gene Expression Omnibus. So this project has been done by my undergraduate student in Galway in School of Medicine. So with the collaboration with Dr. Reda for the bioinformatic analysis. So for this transcriptomic profiling, we have identified 19,000 cells, identified that in the advanced stage, this degeneration versus control, with the keywords we use is the intervertebral disc degeneration. And here you can see the red indicate for the high expression gene, and also low indicate for the low expression value of the expressed gene in this RNA sequencing dataset. And specifically, we want to look at the degenerative feature in the intervertebral disc, which is the apoptosis and the ECM dysregulation. And here you can see the color, the volcano plot indicate the color dot of the orange for the upregulations of the differentially expressed gene that associate with the apoptosis, and also blue that associate with the downregulate gene in the apoptosis. Similarly, for the extracellular matrix regulation, also indicate lots of the key markers in this gene in this RNA sequencing dataset. And here specifically, what we did here is that we see the expression value here. This is one of the apoptotic gene target on the CIDEA and BCL that upregulate in the degenerative disc. So these markers involved in the apoptosis in the intervertebral disc, and also in terms of the extracellular matrix regulation, we found that increase of the enzymatic gene, for example, metalloproteinase that induce in the that mostly upregulate in degenerative disc. And also when we have the upregulation of the degradative enzyme, you can see the suppressions of the anabolic gene, for example, collagen deposition or collagen expression gene in these RNA sequencing datasets of the advanced stage disc degeneration. So moving for the target on the inflammation and pain, what we found here is this volcano indicate for the higher expressions of the differentially expressed gene in this with the inflammation marker, and also we indicate here with the pain related marker. And here we can see that some of the inflammatory marker, for example, interleukin beta, interleukin 6 and interferon upregulate in this data set, and also NGF, BDNF and TRPV1 that has a key roles in the pain sensitization. And interesting enough, we found that anti-nociceptive gene in this degenerative disc, for example, semaporin downregulate and cannabinoid downregulate, which could be a target for the pain later on. So for the last study, I would like to show towards the developments of the organ on chip. Here we have do the computational simulation on the biomechanical of the human intervertebral disc. We know that the function of human intervertebral disc to resist with the compressions of the loads of the axial compression, for example, and this loading will result in the hydrostatic or osmotic pressure. So the idea is to mimic the microenvironment of this biomechanic changes of the hydrostatic in the disc on a chip. So what we did here, first we need to simulate in using a computer system. This has been done by my student in Galway. So what he did is to modulate the pressure in the system and assess for the velocity of the fluidic in the organ on chip, which is that consists of the microfluidic system. So what we found is that the pressure that simulated here was proportional to the shear stress in the microfluidic device system. And also this pressure also can modulate, increase the fluid velocity when we increase the pressure in this device. For the future study in terms of the developments of the organ on a chip device that consists of the hardware system and also microfluidic device. So we're gonna fabricate this device using a 3D printing and 3D bioprinting that encapsulate all the AFMP cell and the RG neuron into the hardware system and incorporate into this device, and then check and then modulate and then try to mimic this microenvironment as to model the miniature of the intervertebral disc, and how we could modulate. We need to wait for the RNA sequencing analysis data to know what are the key target, what are key inflammatory marker that we can induce in this on a chip system. So in conclusion, I can say that I have involved in the regenerative medicine research in terms of developing the hydrogel for the tissue repair. So this hydrogel, it can be as implantable or injectable. So if we design the implantable, it can be used together with the existing surgical approach. And if we design the injectable, we can use as easy through the percutaneous intradiscal injection. So that's the idea. And then from this hydrogel, either it can be HA or collagen-based hydrogel. Both have the therapeutic effect in terms of to reduce pain and also to promote tissue repair. And also both have the efficacy and the safety study. And we have filed the patent for the both HA hydrogel in Galway and the collagen-based hydrogel in UKM. And then using the molecular analysis through a precision medicine, we want to know what are the disease mechanism that can regulate, modulate the pathophysiology of the intervertebral disc that specific underlying the inflammation and pain. And then having that therapeutic target, we're going to incorporate this hydrogel system with the therapeutic target, and also we could use a stem cell, depends on what the outcome we want for the tissue regeneration and also for the pain target. And also from this molecular profiling, it can lead into the modeling, disease modeling. So we could mimic the 3D microenvironment in terms of the under the pathological simulation, biomechanical and also pathological inflammation and pain, so that they will lead into the rapid prototype for the therapeutic testing. And so after all, it will lead into a precision approach for the patient specific therapy in future. So with that, I would like to acknowledge to thank my funding agency and all my mentor and also my colleague and my student that worked very hard in this project. So with that, I'm happy to take any question.
Thank you very much to Dr. Isma for your very outstanding research, actually. So we will open Q&A sessions to the audience. Whoever want to ask the questions, you can ask. And here there is a QR code for the attendance. You can scan for the attendance purpose. There is one question here, Dr. Isma. Good evening, Dr. Isma. May I know what software tools that you used to draw figures, bar charts, graphs, flow charts for data analysis in your slides?
You mean the figure? We use the figure itself, the biorender. But for the design of the chip is different software.
I think
So we
the
use
person
the
is asking your skill for your PowerPoint.
Oh, my PowerPoint. Okay. I use the mostly the figure by the biorender, and PowerPoint I design myself for schematic, and also you can get from the Canva.
Any other questions from the audience? So, Dr. Isma, is that these projects will be only focused to the intervertebral disc or to any other joints in our body, like knee joint?
So at the moment, my focus on the joint, okay, in the intervertebral disc. But who knows, it can be, so whatever we do, this biomaterial stem cell also can apply to other degenerative joint disease, like a knee joint. Okay.
Okay.
Yeah. So at the moment, just for the intervertebral disc.
So any other questions from the audience? Okay, I think there's no other questions. I think Dr. Isma's presentations is very good with all the schematic diagram and anything. And then there's one more questions from Mahi. They ask about, can the research done on bigger sample?
Yeah, so which one? Okay, there's a lot of the in vivo, in vitro, and also the patient sample. For the patient sample, we need the larger sample number, bigger.
For the human sample, is it?
Yeah, the human sample. We're still collecting the patient sample.
So from the ethics, how many per groups usually
For
they allow
ethics,
for the
at the moment we request n equal to 16 for each group.
each?
Okay,
Okay.
that's the yeah. So we at the moment to apply the ethics for the HUSM and also the Sungai Buloh to expand the human collection to speed up this process.
Okay. This research is having a high collaborations with all the universities and also from the overseas. Human sample, because if less adverse effects, then it can be started as treatment. Someone is saying human sample, because if less adverse effects, then it can be started as treatment.
The hydrogel itself, we still need to go through towards the regulatory pathway of the medical device or any implant or injectable format. We still need to do the in vitro, okay, and then in vivo, and then the higher animal model. So at the moment we finish on the rabbit model. But still we need resources, okay, to do like a pilot, but still we need to complete the load bearing animal model first. For the HA hydrogel, yes, we did in collaboration with the company in Japan. But for the collagen base, we just finished in the rat model. We still need to go for the another one animal model before we can test pilot in human.
Okay, so if in case all this is done, so when we are going to start this as a treatment for the patient, to the human, it will be in the which form? Is that it will be in the injection forms or it will be in the chip or something?
Okay, good question. So depends on the plan. Okay, that's why we have both for both formulation. We have both either implant. Okay, we test as an implant as is it in the animal, and also have an injectable format. Okay, both has been tested at least in the rat model, so it can be used both. Okay, for the implantable hydrogel, it can be used for during the existing surgical intervention. Okay, let's say remove the disc and then replace back with the hydrogel. And another one, we can also use the hydrogel in intradiscal injection. Okay, percutaneous, because it's a solution base. Okay, during the injection is a solution base. So when we inject, okay, if uh, it form together, it mixed together with the hydrogel with the cross-linker, it will form the gel in situ cross-link in the side of the tissue when we inject. So that's for the injection percutaneous,
Okay.
intradiscal. So it can be both.
It can be both. On more questions. Good evening, doctor. Is the aim of the study to reduce the discogenic vein or for regeneration of the disc too?
Okay. Okay, for the advanced stage or the severe degenerative features of the intervertebral disc, we know that the reduce of the cell number, so depends on the strategic plan, the treatment plan. So if we need to target the severe, also at the same time we want to relieve pain, so we can use any therapeutic agent or cells, for example, stem cell combined with the hydrogel, and then we implant or inject so that we can have both effect, tissue regeneration and also reduce pain. So the idea is to get both effect for tissue regeneration and also to reduce pain. Yeah.
Thank you. What would be the expected adverse effect if human trial is to be done?
Because this has not been done, at least in our side, I'm not sure about that. What is going to be the adverse effect? Probably the effect on the site of the injection. We don't know in the human, at least in the animal model, we don't see any the reactivity or any immunological reaction. So that's one of the example it might come out for the adverse effect. But still, because I haven't go through this, so I'm not sure about that.
Okay. So I think that's all the questions from the audience. So I would like to express my heartiest gratitude to Dr. Isma on behalf of MEA for your time and also the wonderful but yet a very comprehensive research. We hope that this session has been fruitful and engaging as well, provided everyone the opportunities to gain the insight and knowledge about the disc pain. So we hope these productive sessions will facilitate everyone to be in a happy disposition today. Okay, to all of you, on behalf of MEA, once again, I would like to express our heartfelt appreciations for your contributions and the participation today. So our next ARNS then will be on April. So we hope that all of you will participate in our next ARNS series. With that, I'm Rani signing off. Thank you very much, everyone. Have a nice day.
Thank you again. Bye-bye. Assalamualaikum.
Thank you, Dr.